And tonight I just wanted to take a moment and talk about 10 things that you should look for in a functional medicine doctor. Yeah, you can see her in the background going around on the mower. And so it's very chic right now to say that you do functional medicine. So the first thing that I would do is look for certification. Either go to the University of Functional Medicine, which I'm certified through, or go through the IFM. And I will put the IFM's website on here, but you can go to the ifm.org and you can search their database for a practitioner. And make sure that when you're finding or looking for a practitioner that they are certified completely. Like the IFM has a AMCP that you have taken, and that's just an introduction. That is not what functional medicine is. Then, if you go to the IFM and you go into the practice resources or the patient looking for a practitioner database, then you can start to see who in your area is certified in functional medicine. A lot of functional medicine doctors like myself do things virtually. And so that's the first place to start. Find a truly certified functional medicine doctor. Integrated medicine is not functional medicine. Um, Integrated medicine is incorporated into functional medicine, but it is not functional medicine. And so the next thing starts to every doctor is kind of an artist. And so these are questions that you can ask to see if his particular way of practicing fits your needs. And so, a couple of things that I would look for. Another one, question number two, is do they work in or with a team? And we have found that we're not great at everything. And so, when we're not great at everything, we want to make sure that your experience with us is that that awesome, exceptional experience. And we refer out to people who have expertise in things that we don't do. And that way, we make sure that you have the best experience that you can have. And not only that, you get the best results that you can have if you choose us in this area. Next thing to ask is what is your supplement program like? Because almost every functional medicine doctor does a supplement program. What are his baseline foundational supplements? And what are his like maintenance, or her, I should be fair there, his or her maintenance supplements? And so, like for us, we put everybody on a wellness pack, and it has a little bit of omega 3 fatty acids, it has a multiple, it has a calcium and a magnesium. For women, we put them on a pack that has herbs that help them with. I guess she's gonna go right through it. So she, so we put them on a wellness pack that also includes herbs or herbal support, and for men, we'll do the same thing. So it's very important to kind of know what you're getting into, because one of the reasons why functional medicine fails is people do not get these things explained to them, and then they start to get in over their heads because a lot of functional medicine is not covered by insurance. So you don't want to be one of those people who starts and gets the first set of tests and stuff like that done and then goes right into doing supplements and lifestyle change and things of that nature. You've got to remember functional medicine is about getting to the root causes of problems. So, what is it that is causing you to have a problem? Dr. Hyman does a very good talk on one cause, many symptoms, and many symptoms, one cause. Meaning that if somebody has a headache, you can have headaches because your hormones are off. You can have headaches because you're sensitive to food. You can have headaches because you're stressed out. Why? So that kind of leads into the next one. Oh, and what is their philosophy on supplements? Everybody that's followed this channel for a while knows that our philosophy is we use supplements to get you to that foundational health and wellness, bring your wellness up or health up, and then we want to take you off of stuff. It's just, we don't want to take and put you on a bunch of supplements just to replace a bunch of medications. That's not fair to you, and that's not right, in my opinion. Now, if you need them, that's another situation. I kind of stay on niacin, and there's a few things that I stay on because it really helps with my cholesterol. But you have to do the testing, and you have to know what's going on. So that leads to the next question. Ask your functional medicine doctor, what is your expertise in my problem area? So, like, if you have thyroid issues, have you treated thyroid issues? What is your success with thyroid issues? I say thyroid issues because I had a thyroid issue. I had Hashimoto's, and I no longer have Hashimoto's. So, with that being said, you know, ask them, what do they deal with? A lot of functional medicine doctors actually specialize in certain things. We specialize in foundational health, so getting people to the point that we get rid of all the noise. We can look at one symptom, and then we work on getting that symptom taken care of. And if that's not something that we deal with, then we send you to someone who does. And then here's a big one. What kind of lifestyle coaching do they do? If it's a functional medicine doctor and they don't do any lifestyle coaching, I would make sure I go back and check to make sure that they are certified in functional medicine, because lifestyle coaching is a must. And if they don't do the coaching, they should actually refer you to people who do coaching. So in our practice, Jessica does all the lifestyle coaching. And if she doesn't if it's a special case, we have two other lifestyle coaches that we can refer out to. And then if it's somebody with significant trauma, we have a trauma coach that we send people to. So it's not, it's not cut and dry. It truly is personalized medicine. It truly is getting to know the person, and you got to know that your doctor takes that. Ask them, what's your referral out rate? How often do you refer to other practitioners? And why do you refer to other practitioners? Number 6, what kind of testing do they do and why? If they cannot explain why they're doing the testing that they're doing, and they don't go over the testing with you, then give her a second to get by. If they don't do those things with you and they can't explain it, then once again, I would be very sketchy on that. We're very open about the 3 tests that we do first. We want to know what your stress levels are, how are you waking up, what are your cortisol levels. We want to know what your hormones are doing. We want to know what your DHEAS is and how that flows down into the other hormones. We want to know what your microbiome looks, and this is all in 3 tests. We want to know what your microbiome looks like. We want to know if your gut is working. We want to know if your gut is stressed. We want to know if your organic acids are off, meaning are your mitochondria stressed. These are all things that they should be able to tell you why they're testing you for what you're being tested for. And then how does that relate to my condition? For instance, if the mitochondria are damaged, then you're not producing energy. And if you're not producing energy, then the cells can't have the energy they need to produce the short chain fatty acids and produce the hormones and do that kind of stuff. So there should be a reason and something that they're looking for in every test that they do. So ask them why they're doing what they're doing. Next, do they supplement off the test or off symptoms? And this is, I didn't quite know how to word this, but it's if you come in with cholesterol, oh, you've got a cholesterol issue, and they're not digging into why, and they don't look at what kind of risk are you at, if they're not doing an advanced lipids test and showing you what LP little a is and what your APOB 100 are, if they're not showing these to you and explaining these to you, well, you deserve better, and that's what you need to have, because that's what actually stratifies risk. So if you just come in with high cholesterol, yeah, I could give you yet red yeast rice extract and lower the cholesterol, but am I lowering the right ones? And not only am I lowering the right ones, but then did I give you lifestyle recommendations and tell you foods to eat and the exercises to do and how much sleep to get? You need all of that to heal and to do. Next thing is, so don't go for pill for an ill. You know, don't go for, oh, my joints hurt, here's your fish oil or your specific modifying pro resolving mediators. Don't go for that. And don't go for the, okay, we're going to give you cayenne. Oh, you've got, high blood pressure. Here's your garlic, and here's your blood thinners. And you really got to find out and dig into why. And those tests are out there. Now, number 9. Oh, number 8. Um, do they really look at trying to get to the root cause? And that's the main thing. Are they sending you questionnaires? I mean, the paperwork you have to do should be pretty hefty, because they have to get to know you. They either have to get to know you in person, face to face, or they have to get your whole life story in a bunch of paperwork. And there's really no two ways around it. Otherwise, you're probably dealing with a pill for an ill doctor, and you're going to get 9 million supplements, and you're never going to go off of them. Another one is, number 9 is, how do they test for stress? Do they even test you for stress? So this is something where we get a lot of other doctors' patients. And we consult. I consult with virtual clinics doctors. I consult with transformation enzymes doctors. I'll be going down and teaching for transformation enzymes in Houston. And there's a lot of times that people don't test for stress. And if you don't see what that cortisol awakening curve is, and you don't get that into normal range, and you don't look at the hormones and get those balanced and the neurotransmitters, the person's still going to be tired. They're still going to be cranky. They're still not going to be able to get up and do what they want to do. And they're not going to make their hormones. Their hair's going to fall out. Their sex drive's going to go away. These are all the things that happen, and that can be and should be able to be reversed. And that actually starts with stress. So you got to know what the stress levels are. And then last but not least, do they test for hormones? Do they test the microbiome? Do they look at these things that are foundational to your health? Do you have a microbiome that is more pro-inflammatory, or do you have a microbiome that is less inflammatory? If you go on to the Integrated Health of Indiana's YouTube page and look up the Designs for Health GI Map Explained, I go through that and I explain at a very just high level, just easy, what the test is, what we're looking for, and why we do it. So those things need to be checked, because if you're not checking those things, this is another place where we see, and when we started, we didn't do all these tests, but this is another place where we see functional medicine practitioners fail. And what happens is You'll feel better for a while and you'll stop the supplements and it'll come back. Or you'll feel better for a while and then you will go off the program and it comes back. You can't maintain your health and wellness. So, those are 10 things to look for in a functional medicine doctor. And we'll just run them down real quick. Are they certified? Are they on the IFM website? Are they on the University for Functional Medicine website? I'm on both. Check them out. A lot of people, it's trendy, it's the buzzword in healthcare now. So you have to be careful because people take advantage of that. And they want to say that they're functional medicine when they're really not. Number two, do they work with a team? Do they refer out? Do they have a group of people that work with them on you to get you to feeling the best that you can feel? What's their supplement program like? What kind of experience do they have with your situation? What kind of lifestyle coaching do they give? Remember, they have to give lifestyle coaching. If they don't give lifestyle coaching, then truly you're not addressing the root cause. Number six, what kind of testing do they do and why? Number seven, do they supplement off of tests or symptoms? Number eight, do they do pilferenil, which is kind of like do they supplement off of tests or symptoms? Number nine, how do they test for stress? Number 10, how do they test for hormones? Number 11, how do they test your microbiome and baseline gut health? So, you know, we're kind of unique in that we can do all of that stuff. We can test your hydrochloric acid. We're the only place that I know of north of Georgia and east of the Mississippi that actually has the Heidelberg test. And then we do those other tests and we look at how your body is actually doing. And then we start to repair function to help bring you back to a great level. Well, 53 and it's almost 7:30 and worked all day, got done with flight lessons and gonna go weed eat until we get it done, which will take a couple of hours, and then we got to go in and pack. And this is all in a day's work, and I have the energy to do it. She has the energy to do it. Our patients have the energy to do it, and that's what it's all about. You have a great night. Check out Integrated Health of Indiana on YouTube, and you will get to see a lot more of our videos. And then you can see the GI map test. I think we have a lot of the other tests explained. So we're here to help you. Have a great evening.